Pneumonia is a respiratory condition where the tiny air sacs in your lungs become inflamed due to an infection. This can make breathing not just uncomfortable, but genuinely difficult. While pneumonia can affect anyone, it often sneaks up with symptoms that might be brushed off as a common cold or the flu. That's why it's crucial to recognize the early warning signs, which is what you'll learn by watching this video. So if you're ready, let's get into it. As previously mentioned, pneumonia is a respiratory condition in which the alveoli in one or both lungs become inflamed, often filled with pus or fluid. It can be caused by various infectious agents including bacteria, viruses, and fungi, leading to symptoms and early warning signs that you must be aware of. And this includes the following. Number 1. Fever. Fever is one of the earliest and most common signs of pneumonia. It occurs when the immune system responds to the infection by raising the body's temperature in an attempt to hinder the growth of bacteria or viruses. A person with pneumonia may experience a wide range of temperatures, from mild to high fever. This increase in body temperature can be accompanied by sweating, chills, and shivering. Fever serves as the signal that the body is fighting an infection and prompts medical evaluation, especially if accompanied by other respiratory symptoms. Number 2. Coughing. Coughing is a critical early warning sign of pneumonia and serves as the body's way of trying to clear the lungs. The cough associated with pneumonia is typically persistent and can be dry or produce phlegm, depending on whether the pneumonia is viral or bacterial. The mucus or phlegm expelled can be clear, white, yellow, green, or even blood-tinged. This symptom helps remove irritants and infections from the lungs and airways. Persistent or worsening cough, especially when combined with other symptoms like fever and shortness of breath, warrants immediate medical attention. Number 3. Headache. A headache in the context of pneumonia often results from the body's overall inflammatory response to infection. It can also be exacerbated by a lack of oxygen due to compromised breathing. Headaches related to pneumonia can range from mild to severe and may accompany other symptoms like fever, cough, and general malaise. This symptom is particularly common in cases of viral pneumonia, where the headache might be more pronounced due to the body's immune response to the virus. Persistent or severe headaches, especially when combined with other signs of pneumonia, suggest that medical evaluation is necessary. Number 4. Muscle pain. Muscle pain or myalgia is a frequent symptom of pneumonia, often stemming from the body's immune response to fight off the infection. It is characterized by a deep aching pain that can be felt in various parts of the body, typically worsening with movement. This symptom is caused by the release of chemicals from the immune system that trigger inflammation, not only in the lungs but throughout the body. Muscle pain and pneumonia can significantly impact a person's mobility and comfort, adding to the overall feeling of weakness and fatigue that accompanies this condition. And that leads perfectly into number 5, which is weakness and fatigue. Weakness and fatigue in pneumonia are symptomatic of the body's intensive energy use to fight the infection and maintain vital functions. These symptoms can be profound, leaving individuals feeling overwhelmingly tired and unable to perform even simple daily activities. Fatigue may be due not only to the body's immune response, but also to reduced oxygen intake if the lungs are compromised. This can exacerbate the feeling of exhaustion as the body struggles to meet its oxygen needs. Persistent fatigue, especially when it inhibits routine activities, is a clear signal that the body is dealing with a significant infection. Number 6. Shortness of breath. Shortness of breath or dyspnea is a hallmark symptom of pneumonia and occurs when the infection inflames the air sacs in the lungs, filling them with fluid or pus. This inflammation impedes the lungs' ability to exchange oxygen and carbon dioxide effectively. Patients may find themselves gasping for air after only minimal activity or even while resting, which can be particularly distressing. This symptom is a critical indicator of pneumonia's severity and often prompts those affected to seek urgent medical attention, as adequate oxygenation is crucial for all bodily functions. Number 7. Rapid shallow breathing. Rapid shallow breathing is a significant symptom of pneumonia and typically arises as the body attempts to maximize gas exchange in the lungs, which are partially filled with fluid or pus due to the infection. This type of breathing is an effort to increase oxygen intake but often fails to be effective, leading to further respiratory distress. It can also be a response to pain or discomfort in the chest, prompting the patient to avoid deep breaths. This symptom is a serious warning sign, indicating that the lungs are not functioning properly and that medical intervention may be urgently needed to support breathing and oxygenation. Number 8. Loss of appetite. Loss of appetite in pneumonia patients can result from a combination of factors, including the general malaise and fatigue caused by the illness, metabolic changes, and the body's redirection of energy towards fighting the infection. Fever, nausea, and difficulty breathing can also make eating and drinking uncomfortable or less appealing. This reduction in food intake can contribute to a patient's overall weakness and slow recovery, as the body lacks the necessary nutrients to combat the infection effectively. Monitoring nutritional intake is crucial in pneumonia cases to support the immune system and promote healing. Number 9. Chest pain. Chest pain in pneumonia is often a result of inflammation in the pleura, the membranes surrounding the lungs and lining the chest cavity. This pain can be sharp and stabbing, particularly noticeable during deep breaths or coughing. The pain is typically localized to areas where the lungs are infected and inflamed, and it serves as a protective mechanism, causing the patient to restrict movements, thus minimizing further irritation of the pleura. Such pain can vary in intensity and often exacerbates the discomfort associated with the illness. It is a significant symptom indicating that the infection may be severe and requires medical attention to manage both the pain and the underlying condition. Number 10. Nausea and vomiting. Nausea and vomiting in pneumonia are less common but can occur, particularly in severe cases or when the infection is caused by certain types of pathogens. These symptoms can be triggered by the body's intense immune response to the infection, including the release of various inflammatory mediators or by medication side effects. Additionally, significant coughing can also provoke nausea and lead to vomiting, especially if the cough is persistent and forceful. Managing nausea and vomiting is important to ensure that patients maintain adequate hydration and nutrition, critical factors for recovery in pneumonia cases. But as you can see, understanding and identifying the early warning signs of pneumonia can significantly influence the outcome of this potentially life-threatening condition. It's advisable to see a doctor if you experience persistent symptoms like a cough that won't go away, especially if it's accompanied by thick or bloody mucus, fever, chills, and shortness of breath. Additionally, if you have underlying health conditions like asthma, heart disease, or a weakened immune system, and you notice symptoms of a respiratory infection, seeking medical advice promptly is crucial. Furthermore, if symptoms reappear after seeming to improve, that's another key indicator to consult with a healthcare provider. Because remember, early diagnosis and treatment are key to preventing complications, ensuring a quicker recovery, and maintaining overall health. If you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching, have a blessed day, and as always, breathe easy, my friend.